Okay. Hi there, everyone. Thanks so much for coming and thank you for your patience. Um, so yeah, if you're here, you are here for the Canadian Social Prescribing Student Collective speaker event. So thanks so much for coming. We are part of the Medicine Working Group. We're dedicated to advancing research, education, and advocacy in social prescribing. My name is Ali. I'm one of the members. This is the second event in our speaker series. We have many more great events with speakers working tirelessly to make social prescribing a reality here in Canada. We're always open to new members and new initiatives. So if you are interested in joining our team or learning more, please reach out to us. We will provide an email in the chat that you can use to get in touch, and hopefully we'll see you there. For our event tonight, we'll start off by getting to know our guest, and then we'll have plenty of time for your questions and comments. You can post them to our Slido for this event. I'll put that link in the chat as well. So please feel free to ask your questions there, or you can, like I said, just put them into the chat. There's the link there. Okay, so without further ado, let's get to know our guest. So our guest today is Jade Hamilton. Jade is a community connector with Nexus BC, which is a community resource center in Vernon, British Columbia. She receives referrals from all over the North Okanagan to connect clients with support such as language classes, financial aid, and housing. We're thrilled to have her here and hear about how social prescribing plays a role in her day-to-day work. Jade, thank you so much for coming.
Thanks for having me.
Okay. I was wondering who else had my name on there. I think it's because I sent you my link, but that's fine. Alrighty. So first off, Jade, can you tell me a little bit about the referral process to get patients to you and get them connected to Nexus BC?
Yeah, absolutely. So I have an online referral process. So if you go to nexusbc.ca and go to Community Connector, it's a link that you just click. You put in your information as the referrer, and then you put in the information for the referral. So all I really require for that is their name, phone number, and their address, and then a check mark saying that they consented to be contacted by me. And then once I get that referral, then I make it my job to connect with them. And I usually go out to their home, do a home visit. We generally take some time to get to know each other. And then once we get to know each other, we develop kind of a care plan with a bunch of goals that we're going to work towards together. And then I just continue to follow up with them and ensure that that's working for them. And we adjust the plan if needed.
So it sounds pretty streamlined, pretty carefree for the referring, practitioner. Have they mentioned any challenges that they've faced in getting people sent to you, or have you faced any challenges in receiving and processing referrals from these people?
I think that it's been pretty streamlined. It's been pretty easy for me to get referrals from people. I think that the small amount of information that I'm asking for is pretty easy. I mean, you could probably refer someone in like 30 seconds. The challenges that I've had would be wait lists. I get an awful lot of referrals, and some of those cases come with urgent action required. So I mean, as much as I'm doing social prescribing, a lot of times it comes with a lot of complexity. So sometimes I have to adjust my schedule quite a bit to make sure that I'm doing the appropriate referral in the appropriate order, I guess.
Yeah, so it sounds like we just need more Jades in the world, and
Yeah.
that'll probably just solve the problem, huh? Okay. In terms of the resources that you are helping clients access, what do you think is like the most commonly prescribed or the most commonly needed resources that you feel people come to come to Nexus BC for?
Yeah, I mean, the very first thing that comes to mind would be advocacy. I do a lot of advocacy. And with that, I mean, like a lot of people that are isolated aren't accessing things because they haven't been out, they're isolated, they're not able to voice what they're needing. And even if they are voicing it, maybe it's coming off the wrong way and they're not getting what they're asking for. So when they're going out looking for housing, or they're needing financial assistance, or they're looking for a subsidy or food programs or accessible transportation or home supports, or even just the social connection, sometimes that is not, they're not able to do those things without somebody kind of guiding them a little bit at the beginning usually. So that's where I come in. I do a lot of advocacy. and a lot of kind of guidance with the clients.
Yeah, I think you mentioned to me when we met up that people kind of connected to you for one reason. You ended up like kind of branching out and connected them to all sorts of different resources, huh?
Absolutely.
Okay. Sounds like, just staying up to date on what is available out there is like a job in itself. How do you manage to stay up to date with like the resources in the community?
Yeah, I mean that comes down to just making connections in the community and being a part of that, and advocating for people. You continually make connections, but I do attend roundtable meetings, do networking with other service providers. I participate in training sessions throughout the community. I keep a detailed database. I call it an asset map. So I just have different categories, and anything that comes up in the community that we could offer, I just plunk it in my asset map so that I'm knowing that it's available and I don't forget those assets. But again, yeah, it just comes down to making connections in the community. There's a lot of things out there that you don't really that just don't jump out at you until you start talking to people, and then you realize all the things that you could connect people with.
This asset map that you mentioned, is it something that's like specific to Nexus? Can you share it with other organizations or share it
Yeah,
with other
I
providers
can
then?
share it for sure. Absolutely. I think the idea was eventually they're sharing all of our asset maps from all the different communities with BC 211 so that they can use the things that we've collected and add that to their database as well. So it's definitely a shareable document.
Yeah, and then I guess building on that, like obviously there's the work of putting together this database of what's in the community, and but then sifting through there to find out what's right for that individual person. Like how do you do that?
All of the assets that I put in there, so every different thing has like what they would how they would qualify and what they would get out of that if they were to sign up for that program. So I can kind of gauge it that way. I did work in information navigation and referral for 3 years before this, so I am aware of the different things that are offered in the community. So I'm kind of lucky that way that I already kind of have an idea of which direction to go with people. Um, but again, I lots of times there's things that come out of the woodworks that I would never even think. I mean, I worked with someone for quite some time, and then I went to his house and realized he had 3 bikes there, and his bike was broken, but he hadn't biked in 5 years. So we hooked him up with a little biking community, and now he went biking every day last summer, right? So yeah, it's just trying to like pick apart the different things that might come out of there. And then like we connected him with a walking group through CMHA at the walking track, the indoor walking track that we have here. I can't think of the name right now. But like, like you get to one level of understanding of what the assets are out there, and then it's like a whole nother level comes out once you understand them. So just digging all the time and learning.
Yeah, I guess like tailoring, the services that you offer to that individual person, right? And kind of finding out what matters to them, huh?
To them for sure. And like I can offer a lot of things to them and I can see that it would benefit them. And lots of times they won't take me up on the offer to begin with. And then we start small, and then eventually they end up taking me up on the offer that I originally offered. But lots of times they need to work their way up to being comfortable in that situation. So lots of baby steps.
Yeah, it sounds like it's a quite a lengthy process, huh, to get it done right. It's not just a matter of like a
Absolutely.
one-stop shop and, one size fits all solution for everyone, huh?
No, and I mean, you could work with someone for 2 weeks and fulfill what they need, and then they could come back to you in 3 months and need you again, right? So it's very fluid. They can need me for 6 months, or somebody could stay on my caseload forever, even, like depending on their needs.
And then what do you think are like the biggest gaps in the support system for the people that you serve specifically?
The people I serve specifically are very low income and vulnerable. So, I mean, the biggest gaps that I can see are affordable housing. Mental health services is a big one. And then substance abuse support is another big one. A lot of those things need someone to be supported through that process until they get the actual thing that they need. I mean, like say mental health to start with. You can get mental health help, but there's lots of wait lists. And so, I mean, when you're leaving a vulnerable person waiting and they're not getting immediate support, it's kind of, you're offering something that they can't get right away, right? So it's tough. And then, I mean, a lot of our social programs, they're not tailored specifically to seniors who are experiencing chronic isolation. So when you take them to a social event that would be great for them, maybe there's too many people there, or it's too loud, or too many people are trying to talk to them and they're overwhelmed. Like if they've been isolated for a long time, they're not used to a lot of those things. So a lot of our essential services have long wait lists and immediate support isn't there. And yeah, the social programs are just not tailored to them.
You mentioned seniors, and you mentioned, people with kind of reduced financial means. Are those the typically like the main populations you serve? Are there any other conditions or, populations you try and reach out to?
I will help people that aren't in the demographic of low income and vulnerable seniors, but I do look for that group of people. If you come to me and you're not in the right income range, I'll still offer you services, but it's probably going to be things that you pay for versus me looking for something that you wouldn't have to pay for or would be very low cost to you.
And I guess building on that, are there like any specific resources like you mentioned with like the substance use or mental health disorders? Is there specific resources that you feel are like constantly lacking or like difficult to access for your clients?
Substance abuse for sure. I feel like there's a really big gap there. I mean, I was talking to someone one day and I said, like, why is this person falling through the cracks? And they said, because he drinks alcohol. And I said, well, I mean, like, if this person had schizophrenia, would they be falling through the cracks? And she said, absolutely not. So, I mean, he doesn't particularly want to go get help. He's not particularly like overly hurting himself, but he's not getting the services that he requires because of the alcohol, right? So home care is a problem when he's drinking, but he needs home care to remember to take his pills. So like, it's hard because he grew up in that lifestyle. It's hard to change someone at 69 years old when they've been in living that lifestyle their whole entire life. They grew up in that lifestyle. The cycle continued into their adulthood. And then at 69 years old, you want them to change so that they can have the services that their next door neighbor is getting. Right. So it's a tough one.
Yeah, so clearly some room for improvement there in our system. What kind of policy or like systemic changes do you think would really improve this referral and resource connection process? Like clearly this person that you're talking about has like a need to address that substance use issue before we can start helping them take their medications and things like that. So any ideas on your end?
Yeah, I think that like a blanket approach to holistic and medical healthcare would be a great start. I mean, we always talk about having like an all-encompassing hub where you have your doctor, the nurse, OT, PT, mental health, substance abuse, community connectors, social stuff, everything all in one roof. And so that you're not waiting on wait lists. If you see your doctor and he thinks that, oh, you need some mental health support, you go down the hall and you see the person who's going to give you mental health support. I mean, you can have so many people to be able to do that, I understand, but I mean, ideally in a great setup world, you'd go to one place and have all of your healthcare needs, holistic and medical, taken care of all at once.
Yeah, that is that's a wonderful thought, and we're not quite there yet, but it's lovely to you see people like you kind of working towards that. Especially in our media, we often hear about people falling through the cracks, but alternatively, can you think of a success story where like your role as a community connector has really made a significant difference in someone's life?
Absolutely. So again, like a lot of, although I do have some a great perfect clients that come across my desk where I am just getting them back social and like their housing is fine, they've got enough food, their finances are great. But then you get people on the total other end of the spectrum where they've had a giant crisis in their life. So I was referred somebody who tragically lost his home due to a fire, different fire, not the same one that we were talking about when you were there, Ali. He had 3 days provided at a hotel with emergency support services, and after that, he didn't have anywhere to go. So he managed to grab a few belongings before escaping. And then he was referred over to me. I began collaborating with the quick response team with Interior Health. Together, we met with him. We decided who was doing what for immediate needs. We just kept constant communication, and we pulled together our resources to make sure that nothing was overlooked, formulated a plan, and then we divided up tasks, and then we just went to work. So working with Interior Health, both of us got all of his paperwork sorted out, got a damage deposit for him, and then soon I was able to luckily find him a suitable unit to move in. Then our housing society stepped in for that damage deposit. We sourced him some clothes from a local church. Interior Health retrieved a few of his items from the burnt unit. Transportation, we got him signed up for that with our Better at Home program because he was just taking cabs everywhere, and he's low income senior. It wasn't very sustainable, especially since we moved him to a different part of town. And then once he was in the unit, we had so much more to do. So we got all of his paperwork done so that he could get a rental subsidy, so that he had some extra funds to live there. The rent was a little higher. I arranged for some prepared meals for him. Another organization donated some local thrift shop gift cards, and he could get some new household items. We were able to secure some furniture through another organization. And then we got him set up with housekeeping and laundry service because he wasn't allowed to walk downstairs to the laundry room at his new place due to the stairs and his mobility. And then once we got him settled in, we were able to actually do a little bit of social prescribing with them. So he hadn't been able to do a lot of going out recently because of his feet. He hadn't seen a foot care person in quite a long time. So we were able to get that taken care of. Then his mobility changed a little bit. He was able to walk a little bit better. So then he was able to kind of leave his house a little bit more. He joined our social club. He made a few friends in there. He started talking to his neighbor, and then they started hanging out all the time. We provided him with a friendly visitor that went once a week. They was very consistent, and they became really close friends. And then we were able to track down his lost long family members. Apparently, before that fire, he was working at a different hotel. And when that hotel had a fire, he ended up just moving down the street to a different hotel. And he got very isolated because he lost his cell phone in that fire. And he just went and got a new one. He had lost all of his family for 5 years. So we tracked all his family down, and now they talk regularly, and his whole life has completely changed. So he's kind of a little celebrity at our office. And with the fire chief, apparently, he mentioned his name the other day. And so it was pretty interesting to see the complete change in him, going from someone whose whole life was just going to Safeway and back to now he is very active in our community.
That's incredible. How is this person like referred to you? Was this somebody already on your radar before,
No,
this
actually,
incident?
it was the fire chief who referred him to us.
That's amazing.
Yeah.
It's not just healthcare professionals that can use Nexus and, community organizations like your own. It's also other members of the community, huh?
Yeah, absolutely. The city of Vernon referred us some people a couple weeks ago, and the emergency services has referred people to us, and then mostly healthcare people, but anyone can really refer to us.
That's incredible. Yeah, thanks so much for sharing that story. It's really that's really encouraging. Um, I guess on a personal level, like what motivates you to do this work and, how did you get into it and what keeps you going?
Well, I got into it. I've always kind of cared for people. I worked in childcare for 20 years, and then I was actually a caregiver to my brother and my mother for 8 and then 10 years before they both passed away. And so I've always really wanted to work with people. I moved over to working with seniors, and honestly, the motivation comes from seeing the impact, seeing that gentleman go from the day I met him and you could tell the life he had lived was hard, and to now seeing him, you wouldn't even know he's the same person. So seeing them go from crisis to stability is just incredibly rewarding. Building relationships, not only with them, but with community partners, and being able to have these little successes with community partners when you're collaborating with them is just, it's really, truly heartwarming. So yeah, that's my motivation, just seeing the other side.
That's amazing. You know, that in this role as a community connector, it sounds like you're making a massive difference in the lives of a lot of people that are referred to you. If somebody were interested in becoming a community connector, like how would they go about doing that? Is there a specific training? Did you go through any training of your own?
Um, I guess you just have to find a place that offers that as a position. There's community connectors, a relatively new thing that United Way has implemented into communities. They're very much expanding. If I would say any advice for wanting to get into it would be, sorry, I made notes so I wouldn't get off topic.
We encourage you
um,
getting off topic and, getting into the weeds of what you do.
Sometimes I talk a lot, so I try to stay on topic. Um, Sorry. Oh, I'm beeping over here. Any advice for them? I would say be ready for a lot. I think every single uh every different person has a completely different story and different needs, and even if you have some overlap, you're going to have a very different broad range of things that you're going to have to do for people, and just be open-minded, I guess.
Yeah, like I think your background working with one vulnerable population and kids probably served you pretty well for this one, huh?
For sure.
Um, like on a more general level, like many of us, have friends and family members going through um the similar things that your clients go through, specifically loneliness and isolation. It seems to be pretty endemic these days. Any ways that you see for us to help them or get them connected to community resources like the ones you connect them with?
Yeah, I mean, I would start out small, simple things. Like, I know I have one particular person in mind that I've been working towards getting him back in the community and more social since I started this position. And I knew him previous to this. And I'd say like the small steps are big wins. I mean, I did something like, we have a great person through one of our programs at Better at Home who is a cleaner that I know is very chatty and very, very personable, and will talk to these people the whole time she's cleaning if they want to. So I made sure she was his cleaner, and she comes every week to clean. And now that his house is much cleaner, he's much happier. But I realized I went there 2 weeks in a row while she was there. They chat so much. They're like best friends now. Like, they know everything about each other. So like that small thing, having her come once a week and knowing that she would talk to him and have his house cleaner, made him much happier and changed a little bit. And then I went to his house one day, he wasn't there. He's not left his house in 5 years. He went out by himself. So I guess those small changes, environment, even like, I mean, you don't have to be like right back out into community to be in community. And just making like, yeah, just that wraparound effect for that single person, making sure it's like, to me, I'm like, okay, let's get you out of the house. We'll get you to a social event or even to a social meal with me out in the community. I booked him 3 different transportation rides, and all 3 times he was like, I'm not leaving the house today. But then if I go there and talk to him, he doesn't want to stop talking. So it's the smaller things, getting other people in there and getting him to have a connection with someone who's going to be a consistent person in his life made such a difference. And now you can see the difference in him. So I guess having the smaller wins.
Yeah, so I guess you mentioned, starting small and then having someone consistent in that person's life. Those seem to be like two good solid first steps for getting people out of their loneliness.
I think that, and me having a connection with them, um, those people, like I say, that one gentleman, he didn't give me much for like a couple of months, and I knew him before. And then finally one day he just started talking and he wouldn't stop. And now like I say, every time he goes there, I almost have to tell him I have to leave at some point because he won't stop talking. But yeah, just those small little changes in his life has changed him an awful lot. So, and like I say, he wasn't home one day when I went there, so he went out even on his own. So just those small tiny things, and making sure that you have that connection with them and supporting them through, and then and seeing what they really need, right? Making sure you're there exactly for what they need. He needed a social connection, but he personally didn't care to leave the house, so he didn't want a friendly visitor. And when I called it that, that's not what he wanted. So I've actually stopped calling them friendly visitors. Because you say that, they're like, no, I don't want that. And then after some time goes by and you're like, do you want just someone to talk to? They're like, yeah. So I mean, even the wording of things sometimes, right?
Yeah, the friendly visitor program was one that you mentioned when I was there. Do you mind just expanding a little bit on that, like what it is and how you find people benefit from it? And yeah.
Yeah, for sure. We actually lucked out. We actually got a volunteer coordinator recently, so she's amped up that program a lot. But we just try, I do a little intake with people and get some information about like their interests and things that they're looking to do. Like some people are looking for someone to go to the dog park with because they don't want to do things alone. Maybe they just want to go for a walk or go for coffee, or maybe they just want someone to come over and just read the paper with them, or even just watch TV with them. Yeah, so this we do a little intake with them, find out things that they're looking for, and then we do the same thing with some volunteers, and we try and connect people that have a common interest so that they can get to know each other, and then we keep them connected. Some people have friendly visitors coming 2 or 3 times a week, and some people once a week, and some people once a month, kind of thing. So it's just up to how often the friendly visitor is available and how often the client is looking to have someone come over. But sometimes they even have are just chatting on the phone. Even it just depends on the client's needs, really. But the this volunteer coordinator person has been amazing for making connections. So we've been lucky.
Yeah, it sounds like a pretty unique program and like very low barrier, right? Like it's not like you need a huge number of resources besides a person who's just willing to spend some time with these people.
That's exactly right.
Okay. Um, I guess, a lot of us in this meeting and the ones who might view this video later, we're, medical students, we're going to be healthcare professionals. What advice or words of inspiration would you have for us to kind of spread the message of social prescribing and spreading awareness about it?
I would just keep advocating for holistic care approaches that address both medical and social needs, and just never underestimate the impact of human connection. It's just as important as any medical intervention in my eyes. And yeah, I just think social prescribing is just such a powerful tool that can improve overall health and well-being, and I've seen it a lot, so I see that it works.
Yeah, on a personal note, you're probably going to be getting a few more referrals from the local doctors because I've been, spreading the gospel and telling them to send them Nexus's way. So,
Well,
yeah.
thank you.
Yeah. So thanks so much for answering my questions, Jade. Like this has been really, really enlightening. I think like at this time, I'd probably like to open it up to the group and to the chat. If anyone ha else has any questions for Jade, yeah, please unmute yourselves and ask away. Otherwise, you can also post to the Slido. I've just reposted the link in our chat. Oh wait, I have some questions in Slido. Let's go with those then. Um, yeah, so this one we kind of addressed a little bit in our question earlier, but if somebody were interested in becoming a link worker, like you mentioned how to get a job as a community connector, but specifically, is there any training or anything that somebody could undergo to become a link worker?
Alberta United Way has, it's called link worker training. That is what they gave us for training. So that's what I took. If you're interested in like, if you're really doing information navigation and referral, and then just filling the gap between healthcare and that, right? So when I did that, I always wanted to just do a little bit more, but I just couldn't. So I mean, there's not really a whole bunch of training available, because like I say, it's relatively new, but it just really comes down to filling that gap between healthcare and information navigation and referral kind of thing. But if anyone wants that link worker training, I could pass it on to you.
That would be lovely. Yeah, we can
Yeah,
definitely send it out as a link and even post it on our socials. So yeah,
sure.
please do.
Absolutely.
I guess the next question, and you know, one we're pretty acutely aware of is like, how do you see social prescribing being more integrated into our healthcare system? Like, how do you foresee that happening?
Yeah, like I was saying before, I feel like it should be more of a blanket approach. We should all kind of just be working together. Um, I think if we were all collaborating more, then we could do a lot of less overlap, especially with some of the community nurses. Like I know there is a lot of things that they do that we can do as well. And so if we could take some of that off of their plate and open them up to more important stuff that they could be doing, I think that would be, you know, the best approach to get people doing the things that they should be doing, right? I just think working more collaborative. I can't talk, sorry, it's been a really long day.
Yeah.
Collaboratively, there's the word.
Um, yeah, no, of course. I think you mentioned early on, you know, speaking of taking work off people's plates, you mentioned that a lot of people are initially connected to Nexus because of, you know, helping fill out tax forms, for example. And doctors, you know, historically have had to do that, family doctors filling out tax forms so that patients can access things like, you know, pharmacare and you know, financial supports. So, you know, knowing that they can reach out to you is probably a good sell, right?
Oh, absolutely. And like we have little ins for lots of paperwork stuff. So like if you're behind on taxes, or you don't have your tax forms or things like that, we have workarounds for things. So yeah, always contact us for that kind of stuff. We're definitely available. And we do come out in community. I've um come to the hospital to do a tax return for someone. I've gone to care homes. If you call, we'll come and we'll make sure to get that done for people.
Yeah. Amazing. It's amazing that you're meeting people at hospitals to fill out tax forms. Like, who does
A
that?
lot of people, you know, it's funny, like a lot of word of mouth with us, right? So one person will go to the hospital and they'll call and be like, I need my tax return done before the due date and I'm not leaving the hospital yet. And then you go up there and then all of a sudden you have five more people calling you because they've heard, right? And then yeah. So it's really funny. But yeah, we just try to do what we can. I mean, I'm not gonna leave somebody without a benefit that they are looking to get, or a subsidy they're looking to get because they're in the hospital or because they don't have transportation, or you know.
Yeah, I guess, you know, building on that, you kind of mentioned, you know, you get word of mouth and people start hearing about the wonderful work that you do. Do you ever find that there's not enough community resources, or do you ever find that you have to like turn people away from Nexus or from different resources in the community?
I don't think I'd ever turn anyone away, a wait list, or I've come up, we've been very creative. I've like, you know, we didn't have anything called any laundry service at one point, but our one gentleman that was receiving home care, his biggest issue was his laundry because he had some incontinence issues, and home care can't come and change his sheets and get them changed and things like that if he doesn't have clean laundry and clean sheets and stuff. But he didn't have a washer and dryer anywhere, and he didn't have a car, and he's not mobile enough to walk his laundry 18 blocks to the laundromat. So, you know, for things like that, we just are very, I wouldn't say I would ever turn anyone away for anything. I would just become very creative. So we turned a 2-hour cleaning service into a laundry service, and I provide the coins, and now they go to the laundromat and they bring his laundry clothes back after they're done. And same thing with like emergency meals, like there's nowhere that you can just go get a week's worth of food for somebody and ensure that they have food until they get their pension check or something. So we hit up the local housing society, and randomly they already make a lot of meals, but randomly they were able to make me 42 meals per week. So meals for 6 people, so that I could have emergency meals for people. So if, say, someone was coming out of the hospital and they'd been in the hospital for 30 days and they lived alone, well, they're probably got no food in their house, right? So the QRT team can identify that, and I can bring them food that day just to ensure that they have food. So like, I would say I never really turn anyone away. I would be very creative in what I'm trying to offer, I guess.
Yeah, and just for audience that's not, I guess, familiar with the lingo, QRT is the quick response team. Yeah.
Oh, sorry. Yeah, quick response team through
And
Interior.
those are just like if somebody were to be discharged from the emergency department, basically that's a team of people that are responsible for follow-up for this kind of at-risk individual, huh?
That, or if somebody called central intake and identified them as an at-risk person in the community, they would quickly respond to them as opposed to just being on a list of people that they have to connect with. Yeah.
Great.
Yeah.
I guess, a follow-up question to that is there anything that would make somebody ineligible for social prescribing? Is there something that would automatically be like, oh no, they're not eligible for this?
I mean, I want to say income a little bit, but at the same time, I mean, again, I probably wouldn't say no to offering you stuff. It just wouldn't be free anymore. And I probably would set you up with somebody else who you could pay to do some of those things as opposed to me doing them. But I'm thinking of someone who got referred to me who definitely like had way too high of an income. And I did still help him and set him up with resources, but again, they just weren't like the low income resources that I would offer the other people.
Yeah. Building on that a little bit, you mentioned that kind of the United Way is pretty heavily involved in Nexus BC and in BC in general. What lessons do you think other provinces could have or could learn from what BC is doing or from what, Nexus and Vernon is doing?
It's a big question. I mean, Alberta has been very, very instrumental in doing a lot of this stuff already, so I will give them a little bit of applause. I'm not really sure how heavy the social prescribing has been in the other provinces, but I went to a social prescribing conference in Toronto in September, and there was quite a lot of big people there and a lot of researchers, and I feel like social prescribing has just blown right up. So I mean, I think everybody is on board, and everybody across the provinces have been really scooping this up and running with it. So I'm not really sure. I like I say, I see it everywhere. I see it on all of our calls everywhere. So I think it's really being picked up everywhere, to be honest.
Yeah, so our group has kind of spread all over the place and we've been advertising this event all over Canada. So we have got specific questions about Saskatchewan and from Alberta. Any specific programs that you know of that are doing similar work to Nexus?
Saskatchewan, I'll say I cannot tell you I know anyone in Saskatchewan. Maybe that's the province that needs to amp it up, because now that you've mentioned Saskatchewan, I'm gonna say I have not heard a lot from there. Alberta, I can send you some connections in Alberta if you would like, Jaden. They're they're called link workers in Alberta. So United Way has very heavily scattered them throughout Alberta. So if you just Google Alberta link workers, then there should be a list that shows up of all of them in Alberta. If you do that for BC, that shows up for us. So I'm assuming that will show up in Alberta. And all of our training came from Alberta. They didn't actually even change it from link worker to community connector, and the bottom of it said Alberta United Way. So
Yeah, I'm sure Jaden would be very on board to do that. She's one of our senior members in Alberta. So yeah,
okay, perfect.
yeah, the
That sounds
sooner
great.
when you provide that, I'll definitely forward that to her. Um, I guess we know we're getting some more general questions about like if social prescribing is so new in Canada and BC in general, like how is it funded? You mentioned, some people that are referred to you, they have to pay for services if they're not kind of under a certain income threshold. But for those who are under that income threshold, how are they getting the funding for these programs?
United Way.
Yeah, okay.
United Way is
Kind of
just
already knew the
pouring out
answer.
the funding in so many different programs recently. It's just amazing. So we actually have a few. We have Age Well at Home is actually federally funded, but they don't typically have as much room. Their funding is smaller. But then we have Age Well at Home. So Age Well at Home is funded by United Way. That is income based. So the more the bigger your income, the more you pay. The lower your income, the lower you pay, down to nothing. You could be 100% subsidized if you're a low income senior. That is the case. And then we have contracts for housekeeping through Better at Home. And then we have volunteer drivers, and we have friendly visitors. We have maintenance men and yard maintenance people. So United Way is just really, really pushing to support seniors to stay independent in their homes, and so as long as they possibly can. So all of their programs focus on that, and they do very much focus on the lower income side of the population on that. So they've been amazing.
And not, I guess not to put you on the spot, but like, do you know what kind of drove them to start funding programs like this? Like, did they see a gap somewhere, or was it just from people
Honestly, I
advocating?
don't really know, to be
Okay.
honest. I've only been in a position where I've personally been funded for my job since June. And before that, I worked in the information navigation referral, and that wasn't funded by United Way back then. It is currently now, but it wasn't then. So we were kind of free willy-nilly back then, looking for funding all over the place. So I honestly I couldn't really answer that. I could ask if you wanted an answer to that, though.
Yeah, I mean, if we can, hopefully nudge the provincial United Ways and other provinces to fund similar programs there, I mean, could be the start of something on a more, national level. Um,
Absolutely.
I think when we met, I was asking if there are plans for Nexus to support other populations, specifically with people for like different medical conditions, for example. Um, where would the funding for that come from? Are there specific organizations that deal with those populations?
Well, we always are looking for different funding. When we were talking about something like, say, an art class for someone with Parkinson's or something, that would go through our social club. We do have funding for our social club through United Way. And then they also fund us for for social meals. They fund us for a gathering place. And like, as soon as they fund you for a community connector, they also make you be funded for all of these other things, because I really couldn't do my job properly unless I had all of these other United Way funded programs. It just wouldn't work. Yeah, it just really wouldn't. So
Yeah, and it sounds like they're doing amazing work, and yeah, whatever we can do to keep supporting them, like we'll do
yeah,
on our end for sure.
yeah.
Um, I guess we have another question, which particularly relevant to us as future medical professionals. Um, is there anything that you find particularly helpful or useful that we could do when referring clients to you to kind of ease that process?
Um, it's a really good question. I mean, I don't ask for an awful lot of information. I guess my biggest thing would be just to make sure that the client understands that this is a participation program, as opposed to, like, say, home care support will come in 4 times a day and do a shower assist, give you your medications, heat you up a meal, and make sure you're dressed. but those are things that they're going to come in and do with you. If I show up, I'm not going to say it's time to get dressed. You know what I mean? Everything with me is a participation thing. So as much as I'm going to participate, they need to participate as well. And knowing that there's a little bit of a difference. A lot of times I phone and they're like, well, Interior Health was already here and said that they couldn't help me. And I'm like, I know Interior Health referred you to me because they can't do anything right now. So just knowing that there's a little bit of a difference between me and Interior Health so that they can be a little bit more open, I guess, right?
Yeah, if we have like a client that's a little bit more resistant to getting help from someone like you, is there anything we could do to like nudge them in that direction?
Yeah, again, like I say, just make it like sometimes people are finicky with having help and support, right? So, and lots of times people will be referred to me because they won't take home support even, and they really do need it. So oftentimes if I can get in there and make connection with them and then explain it a little bit better from someone who they've got a connection with, then they open their arms a little bit more and they're a little bit more receiving for sometimes for some things like that. So I mean, just making sure that they realize that I'm not anything medical, that I'm a different person. I'm there just to solely support them in what they want, right? I'm not going to force them to do anything.
Yeah, amazing. We've got possibly two more questions here. Oh, one more just popped in. People are excited. Um, I mean, this is a big picture kind of question, though. It's like any gaps that you see uh, on a social policy level in BC in your role as a community connector. Are you seeing anything that we could maybe improve at that kind of big picture overview?
um Maybe streamlining things. Well, maybe not you guys per se, but like the government, maybe streamlining things for people. Like, you know, if you're a low income senior and you're not computer literate and then you lose your wallet, now you don't have ID. You can't remember where your mom was born, so you can't get a birth certificate. Remember where your dad was born, but not your mom. You know, making some of those things a little more streamlined for that demographic would be helpful to support everyone, you know. And then yeah, just increasing funding to support seniors programming and making sure that it's always going to be there, you know. Like I know United Way is amazing, but like if we had like government change, they could change everything. And then what happens if all of these programs do disappear once they're in place? How do you let them just disappear, right? So I guess some security would be nice.
Yeah, especially for, the people that depend on these programs. I'd like to go from one day to have, your social clubs that you're meeting up with friends and being involved in a community, and all of a sudden, if we have a government change, it vanishes. Like, how detrimental that could be for them, right?
Mm-hmm.
Um, yeah, this is a really good question. They've all been good questions, but this one in particular, just because it's very like practical. Like, how often do you follow up with your clients?
That's a really good question, and a very loaded question because it depends on the client. I have some very needy people, and I don't mean needy in a bad way, but some people that need a lot of support with everything they do, down to phone calls. And then I have some people who I text message with, you know, and then some people I have to meet them at the events that, or even to go do anything. And then there's other people who I meet them at the very first thing, make sure they're comfortable, and then they're off on their merry little way. So I mean, last quarter, I did 469 check-in calls. And that doesn't count the in-person ones because some people don't have phones. And that's just an actual check-in call, not to like do any business. So I do a lot of check-in calls. But I have a lot of clients too. So I mean, I think that the check-in calls wouldn't be quite as much if I had more time to spend out in community. I mean, I'm out in community all day, but as much as I go through appointments, I have that many referrals. So yeah.
Yeah, I guess the second part of that question was actually, do you like personally feel that you have the capacity to follow up with all these people, or do you feel there's like shortages of connectors like yourself?
I definitely don't have the capacity to keep up. I was priding myself on thinking I didn't have a wait list. I was keeping up to everybody. And then it was like the end of November. It just went like so many referrals, like everyone kind of caught on. And so I actually do have recruited somebody who does help me with check-in calls now. So if it's actually just a check-in call and we're just seeing how things are going, or how was your grocery shop with your volunteer driver last week, or how was that social event you went to, or you think you might go to it again, things like that, I do have someone making those calls for me because I honestly, I don't have time to do all of them. And I've had to put in some boundaries because sometimes I'll work until bedtime.
Yeah, no,
So
just thank you in advance for like participating in this because I know it's like at the end of your workday and you're probably pretty tired. And
no, I'm okay with doing stuff like this, but like you 4 o'clock, you get a referral of someone who doesn't have food. I'm not gonna go home.
yeah,
You know what I mean? So, it's
yeah.
yeah.
I guess, to ease that load on you, we had one last question here about any summer or part-time opportunities for students to get involved in social prescribing. So maybe you can, delegate some of that responsibility.
Yeah, we actually will have we applied for Canada summer job student. So we'll probably get that. We actually have someone from Okanagan College who is doing a practicum and needs to do social service work. So he's coming to do some stuff for me as well. Um, they're trying to give me a volunteer. But a volunteer kind of creates work for me because I have to put the work into some sort of form that they can like if they're making calls for me, I need to write down a why for every person while they're calling and then show them how to document all of that. So it does turn into quite a job to have a person help me. But yeah, we're always open to having people come and work with us and do practicums and things like that. I do hope that when our funding ends here at the end of March and they renew us, that they will renew us for more and we can have another community connector because we definitely need it.
Yeah, especially with like all the advertising I've been doing for Nexus, you're gonna get way more referrals, so you're gonna need somebody else there for sure. I guess yeah, the limiting factor there is, Nexus is obviously very important in this region of BC. Um, Anything that people could get involved with at a more provincial or national level in terms of United Way, social prescribing, organizations like Nexus, any leads there for them?
I mean, if you just were looking to learn and hear what's going on, we do have every 3 months, there's a community of practice that anyone can come to. And it's just people from all over Canada on there. And yeah, if you guys are interested, I can send an invite to anybody that wants to join. And then outside of that, I kind of like everything seems a little bit like we have another community of practice that I go to, but it's just our interior people and we're all brand new. So that most people are just like learning stuff on there. They have a social prescribing conference, not this year, the next year, 2026, if anyone wants to go to that. And then I think there's a healthy aging conference that talks a whole ton about everything United Way does, but a lot about social prescribing now, a whole day on social prescribing. They just had it in November, so I believe it's again in November. Those are all the leads I have so far.
That's super helpful, and I'm sure our group will be doing all the advertising for that for the conference. I see Lauren has been posting about a future event because we're continuing the speaker series and just trying to spread the word about social prescribing. So that's
Cool.
our input right now, and the best that
I
we can
love
do.
it.
And yeah, I just wanted to thank you so much for your time. You've been really generous, both having me in your office, but also for this webinar, even on such late notice. So thank you so much.
Yeah,
Uh,
thank you for having me.
Yeah, any resources you have, please send them to me and I'll
Okay,
definitely send them out to the group. And yeah, thank you everyone for coming as well. If you don't have any further questions, so I guess we'll conclude things there. Um, and Jade, yeah, you and me will be in touch.
sounds good.
Amazing. Thank you so much.
Thanks for having me. Thanks, everybody.
Take care.